Well, welcome to Quinnipiac University's COVID-19 vaccine community conversation, empowering communities, informing decisions. My name is Janelle Chisera, Dean of the School of Health Sciences at Quinnipiac University, and I'll be serving as the moderator for this conversation tonight. You know, as of today, or this week, I should say, we have 3 vaccines authorized by the Food and Drug Administration for emergency use, one from Pfizer, one from Moderna, and one from Johnson & Johnson. We are approaching 30.2 million reported COVID cases in the United States. On the vaccine side, 180 million doses of the vaccine have been delivered across the United States, with 140 million doses administered, and therefore made it into the arms of US citizens. While the death rates have dropped by 29%, the number of new cases has increased about 15% in the last 2 weeks overall, and within 9 states, it has increased by 40%. In Connecticut, I think we're doing a really good job. We have 1 million people are partially vaccinated and 606,000 are fully vaccinated, representing 29% and 17% of our population. In an acceleration of the state of Connecticut's vaccination timeline, Governor Lamont recently announced that residents age 16 and older will be eligible to receive the COVID-19 vaccine on Thursday, April 1st. And I can assure you that that is not an April Fool's Day joke. We strongly encourage all members of the Quinnipiac community, as well as all members within our state, to get vaccinated when it's their turn to get vaccinated. Medical advice from national health authorities and the CDC indicates that vaccines are safe and highly protective. And we encourage you to sign up for the first appointment available to you by utilizing one of the registration methods that were sent to you via email. You can do that by registering through a system, the state system called the Vaccine Administration Management System. You can call Connecticut's Vaccine Appointment Assist line, and we will pull up a slide later for you to see these 3 steps, or you can schedule directly with a provider. Some of those providers are offering direct scheduling. We do recommend that students bring their QU student ID to the vaccination center with them on the day of their appointment. While an increased number of people are being vaccinated daily within Connecticut and across the United States, we still have to be very careful for 2 reasons. First, you are not considered fully vaccinated until 2 weeks after your second dose in a 2-dose series, such as with Pfizer or Moderna, or 2 weeks after a single dose vaccine, such as Johnson & Johnson. If it has been less than 2 weeks since your first shot, or if you still need to get your second dose of a 2-dose vaccine, you are not fully protected. And we encourage you to keep taking all preventative steps until you're fully vaccinated. Second, please remember that not everyone you come into contact with will have received the vaccine, and you still may be able to spread COVID-19. Therefore, it's absolutely critical for everyone to do the simple things to protect one another. Continue to wear a mask, wash your hands regularly, stay socially distant, and avoid travel in crowds. We are here today with a panel of experts to help address your pressing questions regarding the vaccine, especially as it relates to the Quinnipiac community. I am so incredibly honored to have our esteemed panelists with us here again today, providing expertise in medicine, law, biomedical sciences, and nursing. We are really honored and happy to have 2 special guests with us here today, Alicia Spearman, who's General Counsel and Vice President of Human Resources at Quinnipiac University, and Dr. Reginald Eadie, CEO of Trinity Health of New England and co-chair of the Governor's Vaccine Advisory Group. Dr. Eadie, Alicia, thank you so much for joining our panel today. We appreciate you being here. If you have a question about COVID and its vaccines, I know that you have come to the right place. I am certain that we have the experts here who can answer those questions for you. I do want to tell you that this is the 4th community conversation in a series of webinars we have hosted over the last 4 months to answer questions and really just to provide you with sound scientific advice and data-driven recommendations so that you can make informed decisions. If you missed our previous conversations, we will put a link in the Q&A box so you can learn what was shared in those conversations. We have added a table of contents to those videos so you don't have to listen to the entire conversation. You can use the table of contents to get right to your question. So panelists, I was hoping that you would take a moment just to briefly introduce yourselves. Mary?
Hi, my name is Mary Peterson, and I am an assistant clinical professor of nursing.
Thank you, Mary. John?
John Thomas. I teach health law and policy at the Quinnipiac Law School.
Great. Thank you. Dr. Eadie?
Hi, Reggie Eadie, President and CEO of Trinity of New England, and I'm also an emergency medicine physician.
Perfect. Thank you. Alicia?
Hi, I'm General Counsel and Vice President of Human Resources at Quinnipiac University.
Thank you. Lisa?
Lisa Kachara, Professor of Biomedical Sciences.
And David Hill.
Good evening. I'm David Hill. I'm a professor of medical sciences in the Netter School of Medicine, and I'm also the medical advisor for COVID for the university.
Great. Thank you so much. Before we begin, I'd like to go over just a few important webinar points. First, this presentation will be recorded and available on demand shortly after it's completed with transcription. Second, we encourage you to engage with us by asking questions in the Q&A feature that's at the bottom of your screen. You can ask questions using your name, or you can ask them anonymously. Finally, if you see a question that comes up that is relevant to you, you can upvote that question by hitting the thumbs up icon, and that will cause the question to jump to the top of the Q&A box. And hopefully we can get to that question a little bit sooner. We appreciate those of you who sent questions up front. We have a lot of questions here to cover today. So panelists, welcome. Let's get right to this with a couple of opening questions. So Dr. Eadie, thank you so much for being here with us. I provided just a few brief points of some data around the state of Connecticut. And I was wondering if you could just provide us with an update of kind of where we stand in the state of Connecticut.
Yeah, sure, I'd be happy to. So recall initially as a state under the governor's leadership in partnership with Commissioner Gifford, we decided early on that we'd follow the CDC's, strictly follow, I should say, the CDC's guidance for our vaccination rollout. And then after about the second phase, we noticed that about 95% of the deaths in Connecticut were in the age group of 55 and above. And so we sort of caucused and sort of changed our direction. We decided at that point not to follow this. Today, I'm proud to say that over 80% of that population have been vaccinated. More good news is that as of April 1st, as Janelle indicated, we will be opening up to the age group 16 and above, or 16 to 44, but can't register to get vaccinated until April 1. Connecticut remains one of the higher performing states throughout the country, but we still have many challenges to go, one being vaccine equity. So we're doing a lot of work on that. So I'll conclude in answering the question, because I know there are a number of questions we're going to get to, by just reminding people that there's an increase in cases, not just across the country, but here in Connecticut. And so this is not the time for us to sort of let our guards down. We need to maintain diligence around making sure that we continue to wear proper masks, the right type of mask, that is, wear the mask properly, as well as social distance. And I think most important, at least on my behalf, it's not to sort of twist your arm in getting vaccinated, but instead to arm you with the knowledge that you need to make an informed decision on whether or not you should get vaccinated. I think we all, and I think we'll get into this a little more in the during the Q&A, but we all have a responsibility as Americans to ensure that we not only protect ourselves, but we protect one another. And as the new CDC director indicated over the last couple of days, I mean, we're approaching the end of the tunnel, and shame on us if we don't do our part to ensure that we successfully transition out of this pandemic. And with cases rising, we're sort of at the crossroads as to what decisions we make to ensure that we do just that. Thanks for the question.
Dr. Eadie, thank you so much. You know, I think at our last conversation, I mentioned that it feels like we're at mile 20 in a marathon. We're tired, but we can't give up now. So thank you for telling us to help protect ourselves and to protect others. Incredibly important. Dr. Hill, can I turn this to you so that we can talk a little bit about what we're doing with regard to the Quinnipiac community? How are we doing?
Sure. Well, I think we're doing very well. And that's really a big thanks to our students, because it is up to the students to do exactly the things that Dr. Eadie just mentioned in terms of wearing their masks, keeping the physical distance, and when they gather, to be responsible about not creating opportunities for transmitting COVID. So why are we doing well? Well, we are at the 20-mile mark of the marathon. We've gone through about 2/3 of this semester, and we can see that we're likely to get to the finish line. And I think that's because everyone is taken to heart the responsibility of being a member of the Quinnipiac community and working together to make sure that we can pursue our academic enterprise. In the fall, we had a challenge. We had the spike of cases, and we had to really close things down. And I don't think anybody wanted to return to that. So when they came back from the winter break, we had a clear message that we really needed to all do our part. We also chose to test all of our students weekly, so that each week we have a clear picture of how we're doing in terms of cases. And so we've tested, we've done 51,000 tests of our students since the beginning of the semester. And we have around a 0.5, 0.6% positivity rate, which is, I think, doing very well. But we can't let our guard down. We need to continue to do this. And we've also taken prompt action when we've seen clusters of cases in terms of, we did have to quarantine a dorm early on in the semester, but we've not had to pursue that since. And we're trying to reward success. So as we continue to do well, we're also opening up our campus. Just as the state is opening up for more activities, we're opening up for more activities. And we look to continue to do that throughout the rest of the semester, as long as we can stay with low levels. So we're excited. Let's put our heads down and keep running for that finish line and be successful.
Great. Thank you so much, Dr. Eadie. Dr. Hill, it sounds like Connecticut and Quinnipiac are doing quite well, and it really boils down to a couple things that I heard you say. Testing, particularly on our campus on a regular basis, protecting ourselves and others, and getting the vaccine when we need it. Dr. Eadie, I want to turn this back to you for another question. I had read recently that about 1/3 of young adults and Black adults, 1/4 of Hispanic adults want to wait and see before getting vaccinated. So Dr. Eadie, there still seems to be, while there's a lot of people who are excited to get the vaccine, there still seems to be a little bit of a level of hesitancy with the vaccine. So Dr. Eadie, is there any advice that you have for those who are on the fence regarding receiving the vaccine, or those who might be in that category of waiting and seeing?
Yeah, so Janelle, let me just be a bit controversial and tangential. So I caution people to use the term vaccine hesitancy. Here's why. If we just reflect on the World Health Organization's definition of vaccine hesitancy, and I happen to think that many of us don't use the term properly. The definition says something like there has to be a delay in acceptance or refusal of vaccines, and here's the key, in the face of adequate vaccine services. We have never in this country, I would argue, had adequate vaccine services. We've not had an adequate supply of vaccines. And I'm sure what's going to come out of today's conversation as it relates to Quinnipiac's offerings of the vaccines, it will prove my point. So by definition, not my definition, the WHO's definition, it's hard to declare vaccine hesitancy when you don't have adequate number of vaccines, which we don't have. I think the president is committed to having about the end of next month or about the end of May. But until then, it's hard to really say who's vaccine hesitant, not. Listen, I don't understand how the vaccine works. I don't understand how the virus works. To me, it's not vaccine hesitancy. It's our responsibility to ensure that we address the concerns and answer the questions. And then when we have no access problems, then if someone refuses to take it, we can declare them vaccine hesitant. But let me answer your question. The ultimate goal is for us to reach herd immunity. And that number sort of floats around. I think Dr. Fauci started off saying that it takes about 70% of us to be immune to the coronavirus before we can reach it. I think the number is now, at least in my mind, it's about 80 to 85%. And so until we reach vaccine hesitancy in our households, in our cities, in our communities, in our places of worship, in our counties, in the state of Connecticut, across the globe, we're going to have to continue to wear masks, social distance, and just live this life that we are not excited about doing after going through it for a year. So I encourage people to get your questions answered, get your concerns addressed, and I high five Quinnipiac for yet another phenomenal conversation, because this is doing just that, which is why Dr. Hill was able to brag about the great results that you guys have had there. But for the people who are still questioning whether or not they should do it, I'm pretty sure that after today's conversation and when the vaccines are readily available to you, many more of you will agree to get vaccinated. The ultimate goal, again, is herd immunity. And until we reach herd immunity, and there's only two ways to do it, right? Through passive exposure, which when we have more than 1,000 people now continuing to die a day, we're up to about 4,000 in this country. We don't want to take that route. The only other route is through vaccination, and that's the safest, most effective and efficient way to reach herd immunity, and that's through the vaccinations.
Perfect, Dr. Eadie, thank you so much. I appreciate that. John and Alicia, I want to turn this a little bit onto vaccine mandates. So recently, Rutgers University announced, and in fact, I think it was last Thursday, it announced it would require students to be vaccinated against COVID before coming to their campus next fall. So that public institution in New Jersey may be the first, or at least others, to take steps with mandates to receive COVID-19 vaccine. So because this is a question that came from our panelists, will we be able to mandate vaccines within our community? And John, I was hoping that you can just kind of give a state of law regarding vaccines, and then Alicia, maybe if we can drill this down a little bit to our community.
Great.
John?
I'll try to be as unlawyerly as a lawyer can be. Let me first distinguish between emergency use authorization and full FDA approval. Once a vaccine receives full FDA approval, there's no question but that universities, employers, and other organizations can mandate that employees and students obtain the vaccine as a condition to participating. At this point, we know that Pfizer is planning on seeking full approval, applying full approval next month, and predicting it will achieve full approval by the end of this year. So that puts no question at all that we could mandate vaccines by early next year. Now, unfortunately, or maybe not unfortunately, it's fortunate because it helps speed up the process. But the 3 vaccines we know exist are being administered under an emergency use authorization, a special program. It doesn't really compromise the safety. The large difference between full approval and emergency use approval is in full approval, you have to get your safety data approved by the FDA before you start production. In emergency use approval, the manufacturer can start production while awaiting approval. So we know that we got approval last November for the emergency use authorization. There is a small debate about whether employers or other organizations can mandate vaccination of a vaccine produced during emergency use authorization. The historical notion has been absolutely not, that the governing legislation says that anybody has a right to refuse. There is a small qualification. The legislation also says that the parties should be advised of the consequences of refusing to accept the vaccine. My belief, and the belief of many people, is that simply means you need to be advised of the health consequences of not obtaining the vaccine. There's some argument right now that those consequences might also be job termination or refusal to allow you on campus to a university, for example. I think that's not a winning argument. It's subject to litigation right now. We have cases in California, New Mexico. We should have preliminary answers from the lower courts within a couple of months. So we should be able to sort that out by fall. So not until once we get the full approval, that should be by the end of this year, more or less. No question, but that we can mandate it. Until then, in my estimation, I'm speaking not for Quinnipiac, for myself, I don't think that's a winning argument. I think people have a right to refuse, but again, that's in litigation.
So Janelle, just follow up on what Professor Thomas said. Under the EEOC, there's some guidance that you can actually mandate vaccinations, but like Professor Thomas said, it's not advisable. So we haven't made a decision to mandate them at this point. We are allowed to, as a private institution, to mandate stuff if we want to, but we haven't made that decision because we want people to voluntarily decide whether they want to get vaccinated for the good of the community and for their own health reasons.
Great, Alicia. John, thank you. I think that boils it down to what was mentioned earlier, which was really focusing on the importance of this and helping people understand that they are safe and effective. So, Mary, I want to turn the question, I'm sorry, not Mary, I'm sorry, David, I want to turn this back to you. I believe that we had said in the outset that April 1st is the date that students are going to be eligible for the vaccine. David, could you talk a little bit about those students who are out-of-state students and international students? Will they be eligible for the vaccine? Could you address that for us?
Sure. In an effort to provide as many opportunities for all people living currently in Connecticut, those whose permanent address is outside of the state or overseas are eligible, can get the vaccine beginning April 1st. So, that's a great situation. So again, I think everyone on the panel is going to say, encourage those who are listening to take the opportunity, if you've not been vaccinated, to sign up, register, and pursue vaccination beginning April 1st. So yes, you will be able to get vaccinated here if you live out of state permanently or you live overseas.
Great, thank you. And is there any kind of proof of vaccination that's going to be required for any members of our community to come onto our campus community at some point?
Well, I think that comes back to the discussion that John Thomas and Alicia Spearman just gave us. And that hasn't been decided. I will just reiterate, why be vaccinated? Because you will protect yourself and you will protect others. There's very good data now. Studies are coming out, not quite daily, but almost, about how the vaccines are also preventing asymptomatic carriage with the virus, so that if you are vaccinated, you're not going to get the virus and pass it on to others. So that's a really important thing. So I look ahead to the possible benefits, is that if you're vaccinated and you're a student at Quinnipiac, you don't have to go into isolation if you're or quarantine if you're exposed. I am sure we'll get to the point where you won't have to be tested if you've been vaccinated. There's a lot of data saying that you're not going to be carriers. You'll be able to gather in small clusters without masks. So there are lots of benefits to being vaccinated. The most important one is you're going to protect yourself and you're going to protect those around you.
So it's not.
If I can just add to what Dr. Hill was saying,
Yep.
from a hospital perspective, once you're vaccinated, you don't have to worry about being hospitalized secondary to the coronavirus or COVID, nor do you have to worry about being on a ventilator or dying. So you couple that with what Dr. Hill said, I can't imagine why the Quinnipiac, as brilliant students as you guys have, why they would not want to get in line and get vaccinated as quickly as possible.
I'll just say, having thought about COVID every day, not quite 24/7, but almost 24/7 for the last year, when I got my first shot, there was this immense sense of relief. And I'll just say what Dr. Eadie just said. I knew that at this point, I was not going to die of COVID. I might die of something else, but that I was not going to be hospitalized on a ventilator, not able to see my loved ones because I had COVID.
Great. Well put. Thank you very much. Mary, I want to switch to you a little bit. What do we know about children and vaccinations, particularly 2021, 2022 school year? Is there any update on children?
There is. There are, the Pfizer vaccine is indicated down to age 16. So there are going to be high school students, starting April 1st that would be eligible to receive the vaccine. They are doing studies now down to age 6 months. Phase 1 is looking at what dosing would be appropriate in different age groups in the pediatric population. And then phase 2 and 3 are going to be looking at the immune response in the pediatric population and any side effects associated with them. What they're saying right now is that for the school entry of 21-22 year, so this coming fall, we should be having the vaccine available for high school students and most likely down to elementary schools. And then younger children looking at the beginning of 2022.
Perfect. Thank you. I have recently heard and have seen some discussion, and in fact, these were a couple of questions that came in through our participants for this conversation, was around vaccines and possible long-term effects or impact on fertility in women. So I was wondering if we can get an update on any data around the vaccine and this idea of infertility, or any thoughts on how this could affect fertility in the future.
There's not really any scientific plausibility as to why this vaccine would affect fertility. We're also not seeing any effects on fertility from people who have been infected. So if there is a protein that is present in the viral infection itself, we would expect to see fertility issues coming out of infection. But the vaccines that were produced are putting immunity to one protein, the spike protein, and there's not really any indication that there would be a reason to worry about fertility. I've seen those rumors out there, and they seem to have been kind of started from one particular place over in Europe, and they seem to have gone viral, as misinformation sometimes does.
And I'll just add to what Lisa said. The American College of Obstetrics and Gynecology, the American Society of Reproductive Medicine, the American Society of Maternal Fetal Medicine have all come out with a recent, very strong statement and said that there's no indication that these are a risk to fertility.
So then it sounds to me like if you are a young female and your time comes up to get the vaccine, whether or not you want to have a child in the future, it sounds like, yes, the recommendation is get the vaccine when you have a chance. Would that be a correct assumption on my part?
Correct.
Correct.
Great. And there was another question that came in while we're on this question of who could be vaccinated. If there was a question from some of our participants saying, if you already had COVID, do I need to wait to get the vaccine?
So the recommendation would be if you have had COVID that you should still get vaccinated. We don't know exactly how long natural immunity lasts. They're predicting maybe 2 to 12 months. So definitely get vaccinated. The two contraindications would be if you have received the monoclonal antibodies. So Regeneron and Eli Lilly both are treatments that if you had COVID, you might have gotten those. And if so, then the recommendation is to wait 3 months. Or obviously, if you're hospitalized and have severe effects from COVID, you should talk to your primary health care provider. But if you've just tested positive or had a regular case, definitely get vaccinated and right along, as long as you're not in that quarantine period. I know one person had to reschedule. Their appointment was the next day, and they tested positive, and unfortunately had to reschedule until after they were out of that period.
So
I can
Lisa,
testify from personal. Oh, go ahead. You can ask that, then I'll give you my personal testimony.
go ahead.
I
Go
can
ahead,
testify
John.
from personal experience. I had COVID twice. First this time last year in March, and then again in December. Both times I got sick enough that my physician wife called an ambulance to take me to the Yale New Haven ER. I also, as soon as I was asymptomatic after the second COVID bout, I got the vaccine. And now I'm 3 weeks post the second vaccine. I will tell you, get the vaccine. You do not want to have this illness. One complicating factor for me was I was also suffering cancer throughout the period, which I'm sure affected my immune system. But anyway, get the vaccine if you can get the vaccine, whether you've had COVID or not. And I'll tell you this, I will be surprised if anybody who's had the disease and had gotten sick from it will refuse the vaccine, because you do not want to get this again. It was a horrifying 2 months of illness both times.
John and Lisa, thank you. So I just want to be clear on this. If you've had COVID, the recommendations are you get the vaccine when you can get the vaccine. The second thing is they will get the standard dosing like everybody else. So for example, if you had COVID, the recommendation is you get it. If you get Pfizer, you get the 2-dose series. If you get Moderna, you get the 2-dose series. And if you get Johnson & Johnson, you get the 1-dose series, correct?
Correct.
Great. So there's yeah, go ahead.
I have seen some rumors going around on the internet that the illness counts as the first dose. That is not scientifically been studied at all. So it is still, you do by whatever the manufacturer recommends for the full immunity.
Thank you for that clarification. I know that was a question that just came in through the chat that we had. So Lisa, I want to kind of stick with you on this for a while here. Can you give an update on where we are with regard to the vaccines? I know we have 3 vaccines. But can you give us an idea of kind of where we are with them? And let's talk a little bit about side effects again, and the fact that that is kind of our natural immune response to those vaccines.
So currently there are 3 vaccines that you could be receiving. And I do get that question a lot of which one should I get? The one that you're able to get first. So it is not something that most people need to make a decision as far as choosing one over the other. The only possible exception to be if you had a allergic reaction to an ingredient in one of the vaccines, there might be a reason why you need one over another. But I tell people, get the one that you can get first. Don't wait to be able to get a different one. There are a lot of worries about side effects. So the immediate side effect would be the worrisome issue of an allergy. So an allergic response would be very concerning, and it's the reason why you're asked to wait for 15 minutes or 30 if you've ever had an anaphylactic reaction in the past, to make sure that that serious but rare event is noticed and taken care of. Except for that, the main side effects that we might feel would be what I would call more immune response effects. I kind of feel, the next day you might feel icky. Somebody asked me, like, is that a medical term or a scientific term? But it basically, some people don't even want to go to work or classes the next day. It's a small percentage of people that might have fever and chills, but it's actually an indication that your immune system is working. I actually make a point, if I notice any of my friends post on Facebook that they had side effects, I make a point of checking in with them the next day, and invariably they're all feeling fine, within 24 to 48 hours. So it's short term compared to, you heard John Thomas talk about, 2 months of, having this illness and feeling icky for a day or two is something that isn't common. It's not everybody who gets the vaccine might experience that, but I think it's a small price to pay to have that immunity and that relief that we're not going to be either infecting other people or possibly having severe illness ourselves. And then you asked about the vaccine. So 3 are currently being administered, and there are 2 that could be submitted to the FDA soon. We have the Novavax, and that particular one is more of a protein-based vaccine. So it's more similar to pertussis and HPV. And I know some people say, oh, I'm going to wait for that. And I tell them, don't wait, get the first one that's available to you. And then AstraZeneca also could be submitted to the FDA for review.
So Lisa, thank you for that. So people who are planning to get their doses of the vaccine and might have concerns about ability to be away from work, it sounds like it is not uncommon to feel side effects, whether it's side effects at the site of the injection itself, a sore arm, redness, a little bit of inflammation maybe, and then also systemic side effects. The recommendation for people like that who are worried about not being able to be at work maybe the next day would be something like schedule your vaccine for a Friday, maybe, or a Saturday. What would be another, would that be the right recommendation there for people who are worried about that?
So if you're worried about it, definitely the percentage of people who can't go to work or classes the next day is small. It's not like 90% of the people feel that terrible the next day. But if it is something that you're worried about, you just have a really busy Wednesday, you go all day, maybe you teach a night class, perhaps you want to be able to, as you said, schedule it for a Friday. That's not an unreasonable, but I wouldn't wait, 4 or 5 weeks out because that's the only Friday that you can get. It's one of those that I would make the decision to get vaccinated over postponing it to a convenient day.
I'm going to say one more time, the vaccine is not nearly as bad as having the illness. Get that vaccine.
Great, John,
And
thank you.
I would say that this has been an unprecedented experience, that we have given tens of millions of doses of COVID vaccine in less than a year in the United States, and many times that around the world. And there have been no surprises in terms of the side effects. Generally people say, well, the trial only has 1,000 patients, or these trials, who receive the vaccine, maybe 20,000 individuals in each trial. But now we have the experience of tens of millions of people around the world. And again, there have been no surprises from these vaccines.
Great, thank you very much.
I think to tie into the side effects too, the question is asked, should you, in a fear of having a side effect, take some kind of a pain relieving medication before? And the consensus is no, you should not. It's a question usually on my immunology exam, like, is a fever good? And we all think of a fever as bad, but it actually is an indication our immune system's working. So the general recommendation is do not take anything, prophylactically. Certainly if you do have a sore arm, a day or two later, taking something afterward isn't something to worry about, but don't just take it because you fear that you might have a side effect.
Perfect, thank you. So Lisa, can you address, or can someone else address maybe the lower efficacy in the Johnson & Johnson vaccine? There was a question about whether there's a greater likelihood of illness because of this perceived lower efficacy of the Johnson & Johnson vaccine.
I guess I would say they're all 100% effective at, preventing death and being on a ventilator and hospitalization. So from that point of view, and that's what Dr. Eadie was talking about, is they're all very good from that point of view. If we look at that endpoint, they're all 100% effective. We're really comparing apples and oranges when you compare Johnson & Johnson to Pfizer and Moderna, both because they're a 1 dose compared to a 2 dose. We don't know if we did a second dose of Johnson & Johnson, would you also be at 94%? Or if you did 1 dose of, Pfizer or Moderna, there's a similar efficacy. It was also done at a different time frame. The same variants were not around when the Pfizer and Moderna studies were done. So if those studies were done now, we don't know if it would have a similar efficacy to Johnson & Johnson. So I would still say to people, get the first vaccine that's available to you. And don't concern yourself that it might be a little bit less effective. They're all 100% effective against severe disease.
Great, Lisa, thank you. Dr. Hill, can I go back to you for recommendations here on campus? I know a lot of people had put in a question up front that was asking whether or not we would be delivering these vaccines similar to the way that we are doing testing. I was wondering if you could address that, Dr. Hill.
Sure. We'd love to be able to do that, but we don't have the capacity right now to do that. So we are actively looking at ways that we could administer vaccine on campus. But right now we don't have the ability to do that, but we will look at that. So I would say for students that, again, when April 1st comes around in a day and a half, go ahead and sign up. And if it happens that we are now able to administer vaccine on campus, you could cancel your appointment, but I would not wait for that to happen.
And I just want to make sure that it's for students that would be vaccinating if we have the capacity to do so at this point, not faculty and staff on campus, correct?
Correct. Thank you, Alicia.
Mm-hmm.
I think Janelle's
frozen. I thought it was me.
Frozen.
No, you're frozen a little bit. I'll just jump in and say there's lots of websites and links that HR can send out to faculty and staff. I know that now we're not allowed to register you through the VAM system, but if you need help, we'll give you tons of links to register. I just registered my teenager. It was very easy to get in. So sometimes try different zip codes because other places that are open, that just open up, it's easy to get in the same week, if that's helpful.
Thank
Colleen?
you. Thank you, Alicia. I appreciate that. As long as we're on some of the vaccinations for the students question, and hi everyone, I'm Colleen Thompson in the Dean's office, and Janelle got booted out a little bit. So I'm just gonna jump in with some questions. We've been behind the scenes answering all your questions. Thank you so much for everyone who's attending. A couple of questions about if the students get their vaccine here and it's the Moderna or the Pfizer, and if they get the first one and now they need the second one, but they're not going to be here for the second one, they're leaving the state. What should they do, or should they choose not to get it? Anybody want to try that one?
So they should certainly get the second dose and try and get the same vaccine that they received before, so that we don't really know about substituting a different vaccine. So I would not do that. If you had the first dose of Pfizer, I would try and get your second dose of Pfizer, and first dose of Moderna, get your second dose as Moderna. So they would just have to work and look at the availability of those in their destination state and their home state. And so each state is going to have the same type of ability to access vaccine scheduling.
I can't speak specifically for students, but I know adults that have been in that situation. They moved within that window of time. And so when you schedule your second vaccine, you don't have to go through like the same qualifications. So one of my friends was eligible here, but wasn't eligible in the state that they were moving to. When they went to schedule the second one, it just says, have you had a previous vaccine? It asks you what manufacturer and what date. and that it just scheduled it. So it might be that if there's another state that 16 and older aren't being given yet in, they still would be eligible. And there are also times and places that are just for that second dose.
And as best I know, every state is recognizing this sort of vaccine reciprocity, every state across the country.
And thank goodness for Johnson & Johnson, because that sort of eliminates this entire complexity.
Absolutely, thank you. Janelle, did you have more questions for our panelists? You want to turn to some audience questions?
You know what, I think we want to, let's Colleen continue with some questions that are coming through the Q&A.
Okay, great. And Mary, I so apologize if you said this already, but there were several questions in the chat, and we were concerned that maybe folks missed your response. Not so much about the young people or the fertility question, which we've seen in a few of our conversations, but about pregnancy. So could you just respond, if you are planning to become pregnant or you are pregnant, should you get the vaccine?
Yes, yes. The answer to that question would be yes. Through different trials that they've done and vaccines that they give, there are women that have become pregnant during those trials that they were doing, and other pregnant women that have had the vaccine. There are currently more studies being done, but what they're finding is that the vaccine is not only protecting the mother, but there is transfer to the baby. So newborns also have extra protection if the mom receives the vaccine during pregnancy. So yes, pregnant women are encouraged, if they fall within the right age group, and now as of Thursday, with the vaccine being available for those 16 and over, yes, they certainly should be.
Great, that's really good news. Thank you, Mary. We have another question here that I like very much about, if any of you want to try this one, what are your tips in terms of talking to and educating family members and friends who seem unwilling to get the vaccine? I'm sure a lot of us are being faced with that issue right now. Does anyone want to take a stab at that? I know, Reggie, we've seen you on TV encouraging these vaccines.
I'll say that being a healthcare provider and working in a pediatric practice, one of the things that I did was I got the vaccine, and so that when my family members say, well, would you do it? I will say, I've already done it. Yes, of course I would do it. So I think being that role model is extremely important, right? Because if you're willing to go ahead and do it, then I think, well, it must be safe. So, and it is, and it is definitely worth a little bit of a side effect to protect yourself and protect your family. So it is, I'm happy that the majority of my family members are becoming vaccinated and the age group is opening up, because it does open up, to be able to sit around the dinner table together and do some family things that we've been hesitant to do before. So
I've had a simpler argument. I simply showed people the portion of my ambulance ride bills that my insurers refuse to pay, and I'm in battle with them. This is serious stuff. And get the vaccine. I'll say it again and again and again.
And I'll say from a personal experience, I'm excited that we haven't seen my mother-in-law, who lives in North Carolina, in over a year. And so by the time my daughter finishes her vaccination, we'll be able to travel to go see her. And quite frankly, once it becomes past emergency use authorization, right, and it's totally approved, I think you're going to have airlines and other private industries requiring you to have vaccinations. So why not get it now, right, to protect yourself, protect your family, protect your community. And quite frankly, I'm sure you want to travel. So if you want to travel and go abroad, study abroad program, some of them are going to require vaccinations. So it just gives you a level of freedom and a level of security, I think, getting vaccinated. So I too was a role model and got vaccinated.
I think also to address their concerns seriously. So find out why they're hesitant. And if you don't know the answer, to be able to kind of answer their question or relieve their worries, direct them to a source, the CDC, the town halls that we've done, something where, there's a lot of misinformation out there. So it's kind of natural with regard to how much misinformation is out there to be a little hesitant about it because of something you've heard that's not correct. But I think sometimes we have to remember that the layperson doesn't always have the same background that we have. I talked to a woman who said she would not get Pfizer or Moderna but she would get Johnson & Johnson. And I said, why? And she says, because there's no RNA molecules going to ever be in my body. Now, as a scientist, I wanted to laugh at her, and I had to then take a step back and say, wait a minute, I just learned something from her, right? A layperson doesn't realize that all of our cells have RNA in them. So I had to do, and I said to her, well, you have billions of RNA molecules in your cells. And she said, well, how'd they get there? And I had to remember that they don't all have the same background we have, and you just got to kind of address them where they're at and be respectful of their questions as far off or as far on as they are, and kind of give them some correct information, and that should help to make up their mind, in addition to all the things that the previous panelists have said.
Yeah, and in addition to that, you know, I've got to say, John is a walking miracle. And I hate to put you on the spot, John, but you express your vulnerability. And, you know, thousands of people every single day don't receive the blessings for whatever reason that John did. Having had COVID a couple of times, and I realize he's got this EMS bill that he's got to dispute. He's a lawyer, he'll be just fine.
Yeah, I'll be fine.
But I would encourage you to have that conversation with yourself and your family members, that everyone is not as blessed as John, right? John probably has 9 lives. Thousands of people every single day have one. And what we don't want and can't afford to happen is for any of us students at Quinnipiac or your friends and family members to prove to not be as blessed as John. And to me, in addition to everything else everyone said, that's a very good reason to strongly consider getting vaccinated.
And I want to emphasize that the impact on a family to have this illness. I mean, there were night after night after night where my lungs felt like they were filled with tar and I could not breathe. And my physician wife has to call an ambulance. It's a real struggle for not just the individual, but for your family. And for me, the possibility that I might give that illness to anybody else I ever encounter it is a horrifying notion. Get that vaccine, do what you can, not only for yourself, but for your family and for your community. Thank you. Yeah, and I do feel blessed. Yeah.
I think most people also talk about it in terms of you either kind of get really sick or you don't, but nobody really is talking much about the people who are these long haulers. I have a nephew who's 40 and he has permanent heart damage from this. People sometimes have permanent lung damage, you know, so it's not just a matter of sometimes if you get sick and recover or not. Some even younger people are having permanent effects from this as well.
That's right.
So Lisa, or one of you along the same lines, I guess, what if you do have an autoimmune disorder? Is it still the right thing to do to get the vaccine?
So absolutely.
Yes,
all of the, you know, the organizations for, you know, rheumatology, I mean, you could go through all of them have said definitely the people with those autoimmune diseases are at higher risk for severe disease and definitely should be vaccinated. They've all come out and, you know, stated that. There has been a little bit of data, mainly with transplant patients, showing that some patients that are very immunocompromised might not make a good immune response to the vaccine. But even the transplant physicians are still recommending that their transplant patients get vaccinated. So that's the worry more so than will you have a reaction to the vaccine, is that you could be vaccinated. And if you're very immunocompromised, you might not make the same antibodies that other people make, and therefore have to rely on herd immunity and have to rely on all of us to be able to prevent from giving you the virus as well.
Yeah, and I applaud the governor because he has asked the vaccinators to prioritize that population, right? So when you think about the 5 diagnoses that we know that we've been asked to prioritize now, you've got sickle cell, you've got Down syndrome, to Lisa's point, you've got organ transplant, you've got end-stage renal disease, and you've got cancer. So those are the populations of people who should run to get in line to get vaccinated, as opposed to some of us who don't have such chronicity and whatever our past medical history presentation is.
And I'll just pick up on that are being vaccinated. You know, we say protect yourself, protect your community, but there are many people in our community who are highly vulnerable to bad outcomes of lots of diseases. And I think it's, you know, it's the responsibility of all of us to make sure that they are safe. And we can do that indirectly by being vaccinated. We can protect those with cancer and transplantation and renal disease and sickle cell disease and from getting this disease by being vaccinated ourselves.
Great. Thank you all for your commentary. I appreciate that. And I think that did answer the question for us. There's a few, I think we have some parents in the audience that might be asking a couple of questions on behalf of their students or concerned about their students here on campus. Some of them are a little logistic. I think, Alicia, you've answered a few. What if I actually had a student who is a healthcare provider in my class. So a lot of our students are getting vaccinated now because they're out in clinical situations. So I did have a student who was having some side effects and I needed to be lenient about class one day. And I think that if the students make sure to tell their faculty members what's going on, I'm sure that people will be flexible as much as they're able to. There was another question about transportation.
I would just say, we are very clear at a university level, at a task force level, that students, if they have the appointment, they should be able to do that. They should tell their professor that maybe they're going to miss the class, but actually they could be, while they're sitting in waiting for their 15 minutes after the vaccine, they can just turn on their phone and Zoom in the last part of the class. But we will be flexible. And we've actually talked about trying to provide transportation for students who don't have that. So we're looking at every way, from bringing vaccination to campus to allowing students to miss responsibilities on campus to make their appointment, to providing transportation.
Perfect. Thank you, David. In fact, that was the next question, was about transportation. So I appreciate that. We do have a shuttle right now that goes into New Haven. I'm sure there will be other opportunities made available if the students need that. And I appreciate that guidance. So I think that we've answered a bunch of these questions, a lot related to the efficacy of the vaccine and worried about side effects and feeling ill. I think that one of the questions here, I'm not sure was answered, so I'm going to give it a stab in case we missed it. How long after the second dose are you considered fully vaccinated? And how long does the protection last? That's kind of a good question.
So the science is suggesting that 14 days post your final, which is first Johnson & Johnson or second Moderna and Pfizer, defines you being completely vaccinated. The science hasn't really answered how long your immunity will last. And that's often a question, and we're waiting for that answer. Lisa or some of the other panelists may have a better answer, but to my research, we don't know the answer to that question yet. So because that often aligns with the question, will it be a one-time vaccination like measles, mumps, rubella? Remember, that's 2 injections. It's very similar to Moderna in that it's 2 injections, 28 days apart, has an efficacy of 97%, versus the flu vaccine, right? We know that you don't have immunity from the flu vaccine for very long, so that's why it's an annual injection. So we're yet to learn more from the science as to what the answer to that question is.
I might just add, and it looks like it's going to be longer than the 3 months. I mean, there is some of the early trials with Pfizer started over a year ago, and those individuals are showing evidence of ongoing protection. So I think there will be, longer term protection than the 3 months that we're concerned about. Will there be annual or every other year vaccines? That also depends on how widely the variants go around and whether or not those variants, I mean, right now the vaccines may not be perfect against all the vaccines variants, but they're pretty good. They will save your life, which I think is very important. But it may be that we have a multivalent, a multi-part vaccine, just like we have flu. So if you get a flu vaccine each year, there are either 3 or 4 different flu types in that vaccine. So maybe in time we'll have a COVID vaccine that has multiple types in it. So that's all to be determined, as Dr. Eadie has said.
And they've already started the clinical trials on that. Both Pfizer and Moderna have a 3-arm trial of people who've gotten 2 doses. They're going to give them a booster in the fall. And so one arm is just the 2 doses. One arm will be a booster of the same vaccine. And the third arm will be a booster with the B1351, the South African variant, to be able to determine that. So they're looking at it not just based on, we'll wait and see. They're actively doing those types of trials to get scientific data for that as well.
Absolutely. Yeah, thank you so much. It really is amazing how much we've been able to do in this period of time. It's utterly astounding. A little bit more for the students, because we are going to have to wrap up probably soon. One question is about the students' communication. Are they getting emails with information? How do they register if they want to get one? I know we have a slide that I think we put up at the beginning, and we'll probably tack that on at the end. Have they been getting emails telling them what to do?
So the entire community, both faculty, staff, and students, did get an email on Monday talking about the eligibility for vaccination with information about that. If they go to the FAQs, and we'll make sure that we include that link, there's probably 20 questions and answers about vaccination. And then there's also a very helpful table that has been put together for how one accesses vaccination in Connecticut, and we'll make those links available to everyone.
Great. I think we are at about 7:27. We are going to need to wrap up our event here tonight. I want to thank you once again to our panelists and our participants present here today. Dr. Eadie, I can't thank you enough for being here, showing your support for Quinnipiac and providing important information to our community, particularly our Quinnipiac community. Please make sure that you understand that there is a process for you to get the vaccine. We had put that slide up there for you. All the students have received an email about that process. So please do follow that, just as our panelists had said. We are working here on Quinnipiac on other arrangements, but please, in the interim, on April 1st, definitely go ahead and be proactive and register to get your vaccine through one of the 3 processes that were sent to you by email or that we shared with you. We encourage you to join us in the future as we continue these conversations about the COVID-19 vaccines. On behalf of Quinnipiac University and the School of Health Sciences, we wish you all health and wellness. Be safe, be well, and go Bobcats.
Thank you, everyone.
Thank you, everyone.